Hello and welcome to our discussion today on high blood pressure prevention and treatment. This is Fung Tran from the Prevention and Treatment Health Support Network or pthealthsupportnetwork.com. How do you prevent and treat high blood pressure? Let's pretend that all the problems related to high blood pressure is a bunch of chopsticks. And each of the chopsticks represent one problem related to high blood pressure. And in order for me to get rid of my high blood pressure, I have to somehow be able to break this whole bunch of chopsticks in half. As you can see, it is impossible for me to try and break the whole bunch at once. How do you break something when it looks like it's unbreakable? Or how do you fix something like high blood pressure when it looks like it's unfixable? With a bunch of chopsticks, I cannot break the whole bunch at once, but if I split the problem out into smaller problems, if I split the chopsticks into individual chopsticks, I can break them one by one. And eventually I'll be able to break the whole bunch of chopsticks in half. Can we do the same with high blood pressure? Let's try and do that. Let's say I split the problems of high blood pressure into 4 smaller groups. And I put it into a summary. I call it the High Blood Pressure Chopstick Summary. The first group of problem, I will call it the causes of high blood pressure. This will include anything that causes high blood pressure or make it worse. The second group of problems, I will call it the damages related to high blood pressure. So this will include any physical damages that happen to your body as a result of high blood pressure. The third group of problems, I will call it signs and symptoms of high blood pressure. So this will include anything that you are experiencing or any difficulties that you might have as a result of high blood pressure. The fourth group of problems, I will call it the consequences of high blood pressure. So this one is a little bit of forward thinking. What would happen to you if your high blood pressure is not managed or not treated properly? Then the consequences will not be good. So to explain how I have divided the problem into these 4 smaller groups, let me use a simple example. Now, let's say for some reason I like to play with a knife. I want to test it out to see how sharp my finger is. And somehow I managed to cut my finger. Okay, and have a big cut on my finger. So what is the cause of this problem? Is that the cut on my finger, or is it because I play with the knife? It is very important to distinguish between the cause and the damage. When you are treating the cause, you are working on a cure. So if the cause is playing with the knife, and I stop playing with the knife, then within a few weeks, the cut on my finger heals and I'm cured. So the damage would be the cut on my finger. It is also very important to treat the damage, but when you treat the damage, you're not working on a cure. You're only slowing down the progression of the disease. So to treat the cut on my finger, I would put a band-aid on. So prevent my finger from getting infected and allow it to heal quicker. Signs and symptoms of this problem would be the pain and the loss of hand function that I have from having the cut on my finger. Now, when I treat the signs and symptoms, it does not cure the problem, it does not slow down the progression of the disease, but it's important to minimize the pain and discomfort that I will have from the cut finger, and it allow me to get on with my life. Consequences. What if I don't stop playing with the knife? Sooner or later I will have more cuts and I will have more damages, and it will be more painful, and I might lose my ability to use my hand for work, and I might lose income from my silly habit. What about high blood pressure? Now, high blood pressure is a lot more complicated than a simple cut in the finger, and it has a lot more worse consequences compared to just a cut on the finger. Before we start on high blood pressure, for you to get the most out of the discussion today, I would recommend that you get some pen and paper handy. Write down the Chopstick Summary, divide your page into 4 columns: causes, damages, signs and symptoms, and consequences. When you've done that, come back and we will start the discussion.